Hi, I'm Phil Newsome and I'm the Director of the Centre for Translational Medicine, a role I've been doing since June 2024. Prior to that, I was Director of the NHS Biomedical Research Centre in Birmingham, and I'm also clinically active and run a large service for people with steatotic liver disease or SLD. I also lead multiple global trials of new diagnostics and new therapies, and my research is very much driven by my clinical practice. And that's why I really want to champion translational medicine, including moving towards more personalised healthcare approaches that really meet the needs of our patients and help to reduce health inequalities. So personalised healthcare means that the strategies we use to treat and support an individual take an account of the whole picture: their particular characteristics, their genetic makeup, their needs, the environment they find themselves in, and also their lifestyle. Now, these days, people may be living longer, but often they're living with multiple long-term conditions such as diabetes, cardiovascular disease, dementia, or mental health challenges, which means that their quality of life may be poor. And we therefore need to be providing care that recognises someone's individual circumstances, especially if we're going to have a sustainable healthcare system in the longer term. Now, there is incredible research going on at King's and so much expertise across the partnership. But often the challenge is it can take years for the benefits of discovery science that's going on in our labs to be really felt by patients. And therefore, by working across disciplines, involving patients early and putting the right infrastructure and training in place, we're trying to speed up the process and ensure that our research has the maximum impact. I'm also really proud when I reflect on the diversity of the people and the projects we have funded. In our first year, we awarded 39 awards, totaling 9 million, covering many different fields of research. And I'm also proud of our commitment to working with and involving the local community here in South London. As the director of the CTM, my role is to ensure the organisation is well positioned strategically to be able to apply for large-scale infrastructure and research grant applications for experimental medicine and translational research. Now, I believe that to do so, we must take a fresh approach to partnerships. So that might mean working in different ways with a range of NHS organisations. And I also firmly believe that we must work across disciplines to support that personalised healthcare approach that I spoke about earlier. Fortunately, collaboration is something we do very well here at King's. We also need to be building closer links to our local communities by creating those long-term relationships based on trust. Now, there is information about the CTM on both the King's website and also the King's Health Partners website, and you can follow the CTM on LinkedIn. I would very much encourage you, if you're a clinical professional with an interest in research, to please put in a funding application.